My name's Carrie Van Der Weyden. I'm a haematologist. I'm also a researcher, and I work at the clinical haematology unit that sits in Peter MacCallum Cancer Centre and the Royal Melbourne Hospital. So that's actually a great question. So because these are rare conditions, we emphasise in haematology that this needs to be approached collaboratively, and we recognise that a haematologist who works in remote Australia may only see one of these patients a year, as opposed to someone with a much more common blood condition. So there are different ways in which that happens. Sometimes it's an informal process whereby those haematologists will ring people working at tertiary referral centres, so big hospitals that see a large number of patients with this condition. And sometimes it's actually through a process whereby we have what's called an online multidisciplinary meeting, whereby patients, treating doctors can put together a summary of the case and have a whole group of clinicians who are experts in the area review not only the biopsy results, scan results, so PET scan or CT scan results, review the story of the patient's condition and say, and give some advice about not only do we think we have the right diagnosis, but also what do we think are the most appropriate approaches to treatment. The other thing I would encourage people to do is to be proactive in terms of searching out information for themselves on the internet using things like the one that we're using today, which is Lymphoma Australia. So that it's a combination of both you as the patient plus your healthcare professionals looking after you.